Good afternoon, everyone. Yeah, there is some glitch in the screen sharing. Hello, good afternoon, everyone. Hope this screen is visible. Yeah, so good afternoon, everyone. Today, let's start with a new topic of deepan and pachana. Here in our syllabus, we see that these So good afternoon, everyone. We have this in syllabus as the deepana pachana concept. So yeah, basically, when we want to do any shodhana or panchakarma, first thing comes to our mind is whether that uh, patient is eligible for shodhana or not, right? Once we select that this patient, this rogi is suitable for panchakarma, then second thing which comes to our mind is whether the agni of that patient is uh, enough for the procedures whatever we are conducting. So that we assess the Agni in two levels. One is Abhyavarana Shakti, the amount or the quantity of the food the person is able to consume. Second is whatever may be the quantity, whether that patient is able to digest it and absorb it. Right? These are the two concepts. The consumption may be good, but the digestion and absorption may be hampered. Sometimes consumption is very less, but the absorption, everything will be very good. Hence, these are the two separate concepts, deepana and pachana. We a patient when we give any deepana dravya, they tell that the patient uh, tells that his Agni is good. The Abhyavarana, the consumption, the quantity of the food he is consuming is good. But there is no change in the ama which is present in his body. So that is very important to be considered here. Yeah. So Sharangadara tells Pachetna Amam Vanti Kricha Deepanam. Okay. Then there is one more definition, that is Deepanam Deepayati Vanhim Iti. So completely Deepana is related to Agni, nothing else. Deepanam Antaragnehe Sandukshanam. What this Deepana does? Deepana is going to improve the Agni. By that it means Agni will be improved, that is the quality of the quantity of the pitta is more, so the patient obviously feels hungry and he consumes more comparatively. And for that, beautiful example given by Sharangadara is Shatapushpa. We can also consider that it's not only the drug which can act as deepana, activities can also be deepana. Drug or activity which gives strength to Agni can be considered as deepana. Deepana Dravyas are Agni Mahabhuta predominant in nature. Hence, Samanyam Vriddhi, based on the concept of Samanyam Vriddhi Karanam, these Deepana Dravya directly increase the Agni. They improve Abhyavarana Shakti. That is, they improve the consumption, that is the intake. Okay, they improve the quantity of the food a person consumes. So, because Shatapushpa is considered as the best Deepana Drivya, let us go through it once. Shatapushpa Lagu Tikshna Pittakrit Deepani Katu Ushna Jvara Anila Shleshma Vranashula Akshirogarat. When we see the the som or else whatever the after meal in usually in restaurants we get this som, right? Shatahva Katuka Tikta. Why we consume it? Because it is Gatuka Tikta Snigdha Ushna Shleshma Vatajit. And Jwaranetra Vrananhanti Bastakarmani Shasyate Shatapushpadala Chaukta Vrishya Rudira Gulmajit Vatagnam Deepanam Stanyam Pittakrit Ruchidayakam. One thing is it improves the Agni, it is Vatahara in nature, it improves Pitta, it is Tanyakara in nature, and Ruchiprada. It gives taste to the tongue. Hence, this Shatapushpa is considered among best of all the Deepanaya Dravyas. Next, we will consider a few things regarding Deepana, that is, what are the rasas which cause Deepana? Lavana and Tikta rasas, according to Charaka, they cause Deepana. Katu, according to Sushruta. So, you can see that um, Katu, usually we think spicy things improves Agni, right? But Charaka tells even Lavana and Piktarasa, because they have that Ruksha nature, and also they improve the Pitta, they increase the Pitta. Hence, um, Rasa like Lavana, they are Deepana in nature. Drugs, Deepaniya Dashamani is mentioned by Acharya Charaka. Coming to water, that is food, hot water, coconut milk, gokshira, narikshira, takra, madhu, lavana, hingu, etc. are considered as Deepana. Then activity, snana and vyayam are considered as Deepana in nature. Rutu, Varsha Rutu needs maximum care for Agni, as Agni will be very manda during this season. Hence, all these Depaniya Dravyas come into action, especially during Varsha Ritu, because of various reasons in Varsha Ritu, Agni will be very, very manda compared to other Ritus. When we consider this Dipaniya Dashemani, see, Pippali Mula, Chavya Chitraka Nagare, that is Shringavera, Amla Vetasa, Maricha Ajamoda, Vallatakaasti, Ingu Niryasa iti Dashemani, Deepaniyani Bhavanti. So these are the 10 drugs which come under Deepaniya Gana or Deepaniya Dashemani. 10 drugs which are called as Deepaniya in nature by Acharya Charaka. So now coming to time. When is the best time for Deepana process? That is Aparanha Kala, or in the afternoon, when the even when we see outside It is Agni Mahabhuta predominance in the Aparanha Kala and Madhya Bhakta. It is in between the meal, Deepaniya Dravyas have to be given. And it is, we know that Deepana, we do this Deepana under three headings. One is before Shodhana as Purva Karma. We know this perfectly, right? Chitrika Divati, Ashta Churna, Talisadi Churna, etc. We give for Deepaniya action, that is before Shodhana. Okay. After Shodhana, also Deepana is to be taken care of, because due to the action of Dravyas, or due to the procedure itself, or due to the restriction in the food, after Shodhana, that is after Vamana and Virechana, the Agni will be very manda. Hence, improve that Agni gradually. We advise this Peyadi Samsarjana, right? It is because we cannot increase the Agnis drastically, because Shodhana would have caused Balahrasa at that moment. If a patient has undergone Virechana, he had 20-30 Vegas, you cannot just ask him to take food, right? He's, there will be loss of fluid, there will be Balahrasa, the patient will not have the energy to have food. Hence, improve the bala, to improve the Agni bala and also Sharirika bala, Peyadi Samsarjana is advised. And this Peyadi Samsarjana is, in a way, it is Deepana in nature. And in the management of Vyapats also, in few Vyapats, we have this Deepana as a line of treatment, that is in Hridgraha, Klama, etc. If you go through these Vyapats, Deepana is a line of treatment. Hence, Deepana is not only we consider as Purva Karma, but in after Shodhana, we consider Deepana. In the management of few Vyapats also, Deepana is a line of treatment. And when you go through different yogas in our classics, Gudochya Digana, Vikatu, Brhat Panchamula, Amalakya Digana, etc., they are also having the action of Deepana. And now, coming to how this Deepana works, Deepana Dravyas, they promote gastric juice secretion and facilitate digestion. We know that the gastric juices are responsible for the, it is the first level of digestion, right? From mouth till stomach, it is the first level of digestion. Small intestine, where pancreas, liver, gallbladder, every other organ they contribute. That is the second level of digestion. Third level is the large intestine. Hence, this Deepana Dravya act at the first level of digestion, where gastric juices are secreted and the saliva is secreted more. So they in turn facilitate the digestion. Second is it sensitize oral taste receptors and facilitate salivation. When we, for example, if we go through the Dravyas under the Shemani, we see that Maricha, Jamoda, Shunti, then Chitraka, Pippali Mula, etc. All this you can see that when you keep it in the mouth itself, there will be a lot of salivation, right? Hence, Deepana Dravya's action starts from the mouth itself. Hence, it sensitizes oral taste receptors and facilitates salivation. We know that saliva has a lot to do with digestion, right? If the food is not mixed with saliva properly, the bolus, that the paste like form, if it is not formed, then the digestion is hampered. Hence, this dravya, this Dipani dravyas they start their action right from mouth itself by um, increasing the salivation, by sensitizing the oral taste receptors, by improving the gastric juice secretion, etc. They act, Deepani Dravyas act. And where and all in our classics we see this Deepana as line of treatment. First is Jvara. In Jvara, they tell that Ushna Jala will cause Deepana, because Ushna Jala, we know that it will be lagu in nature, it is Deepana, and it causes Rotoshodhana. Hence, in Jvara, Ushna Jala is a line of treatment where it causes Rotoshodhana, Jvaragna, and it is Deepana in nature. Second is Takra Prayoga in Kafajagulma, Grahani, etc. Takra is also Deepana in nature. Hence, it is indicated in Kafajagulma Grahani, etc. Then Deepana is a line of treatment in other diseases like Admana, Annavritavata, Udanavritapana, Kshayajakasa, Rajayakshma, Arshas, etc. Then we find this Yavagu that is in Charaka Sutrasthana. We find this yoga that is Deepaniya Yavagu for Shula. Okay, so this is about Deepana. I'll continue till the meeting is on, and we can continue in the next class. So we understood about, or else what I'll do is um, I'll again summarize about Deepana. So Deepana is a process which increases the Jataragni. Okay, it improves it does the sandukshana of Jataragni, and it is not going to digest the ama which is present in the body. Hence, the action of Deepana is only till amashaya. Okay, and it is not going to deal with the ama present in the body. It is very simple. Hence, the action of Deepaniya Dravyas are from saliva mouth till amashaya. And Deepana can happen due to drug or due to activity or even food. It can be anything. For example, if I drink Ushnajala, that also causes Deepana. It is not a drug. Snana also causes Deepana, and that is not a drug, right? Hence, Deepana can be a drug or a food product, or else an activity which increases the Agni or which gives strength to the Agni. And we, after seeing the Guna Karma of this Deepana, it is clear that it is Agni Mahabhuta predominant in nature. After we do this Deepana, what happens? The patient is able to consume more, that is the quantity of the food he consumes will be more. So these are the definitions of deepana, that is pachetnamam vanhikacha deepanam, deepanam deepayati vanhim iti, deepanam antaragnehe sandokshanam. So shatapushpa is the best drug for deepana. Then we have this dashemani, that is pippali moola chavya chatka shringavera amlavetasa maricha ajamoda ballattakasti hingu niryasa iti dashemani deepaniyani bhavanti. This is according to Acharya Charaka. And Lavana and Tiktarasa are Dipana in nature. Katurasa according to Shishruta. Hot water, coconut milk, Gokshira, Narikshira, Takra, Madhu, Lavana, Hingu, etc. are the foods which are Dipaniya in nature. Snana and Vyayama cause Dipana. Then we have Varsha Rutu needs maximum care for Agni, as Agni will be very manda during this season. Then the kala for this Deepaniya is Aparanha kala or Madhya Bhakta, that is in between food. We have consumed, if, for example, if a patient is having 4 idlis, after having 2 idlis, he consumes this Deepaniya Dravya, then again he consumes 2 idlis. So Madhya Bhakta is the perfect timing for Deepana. Before Shodhana is Purva Karma, we do this Deepana using Chitrakadivati, Ashtak Churna, Talisadi Churna, Vaishwanara Churna. So many yogas are there. After Shodhana, in the form of Peyadi Samsarjana, we include Agni. In the management of Vyapat, few Vyapats like Hridgraha and Klamana, Deepana is a line of treatment. Then few yogas like Guduchya Digana, Tikatu, Brihat Panchamula, Amalakya Digana, etc. They are Deepana in nature. When we see the mode of action, Deepana Dravyas promote gastric juice secretion and facilitate digestion, sensitize oral taste receptors and facilitate salivation. It induces gastrin secretion. Hence, Deepana, it acts from oral cavity till stomach. And after that, it is Pachana Karma. And in Jvara, we have Ushnajala as Deepana. In Kafajagulma, Grahani, Takra is line of treatment, that is Deepana. In Admana, Annavritavata, Udanavritapana, Kshayajakasa, Rajayakshmarshas, Deepana is a line of treatment. And Charaka mentions this Nipaniya Vagu, which has Pipali Mula Chavya Chitraka. It is indicated in Shula. So In the next class, we'll continue with Pachana, because if I start with Pachana today, it will be incomplete. Hence, I thought it is better to continue Pachana in the next class. So, if you have any doubt, please let me know. If you have any doubt, please you can contact me, or in the next class we can discuss. So, let me stop sharing the screen. Yeah, I'll leave the meeting. So in the next class, we'll finish with this syllabus of Pachana, and how Deepana is related to Langana and Pachana is related to Rukshana, and what is the practical applicability of this Deepana Pachana in the OPD level or IPD level, how we can make use of this Deepana and Pachana. We'll discuss in the next class, and we'll finish this part. So if you have any doubt, please let me know. Thank you.